Assalamualaikum and hi. In this video, I'm going to talk about HIV. Most people already know about HIV. So, here I will talk more details about it. What is HIV? HIV is a virus that compromises the immune system. There's currently no cure for it, but there are treatments available to reduce its effects on people's life. In majority of cases, once HIV infection takes hold, the virus stays in the body for life. However, unlike what may occur in infection by others type of virus, HIV symptoms doesn't suddenly appear and peak overnight. What are the symptoms of HIV? There's several symptoms of HIV. Not everyone will have the same symptoms. It depends on the person and what stage of the disease they are in. There's 3 stages of HIV and some of the symptoms people may experience. Stage 1, acute HIV infection, meaning 2 to 4 weeks after infection with HIV, about 2/3 of people will have a flu-like illness. This is the body's natural response to HIV infection. Flu-like symptoms can include fever, chills, and many more. These symptoms can last anywhere from a few days to several weeks, but some people not have any symptoms at all during this early stage of HIV. Doesn't assume you have HIV just because you have any of these symptoms. They can be similar to those caused by other illness, but if you think you may have been exposed to HIV, get an HIV test. Stage 2, clinical latency. In this stage, the virus still multiplies, but at very low levels. People in this stage may not feel sick or have any symptoms. This stage is called chronic HIV infection. Without HIV treatment, people can stay in this stage for 10 to 15 years, but some move through this stage faster. Stage 3, AIDS. If you have HIV and you are not on HIV treatment, eventually the virus will weaken your body's immune system and you will progress to AIDS. This is the late stage of HIV infection. Symptoms of AIDS can include rapid weight loss, recurring fevers, and profuse night sweats, and many more. What is antiretroviral therapy? The treatment of HIV or AIDS with medicines is called antiretroviral therapy. It is recommended for everyone who has HIV. The medicine doesn't cure HIV infection, but they do make it manageable chronic condition. They also reduce the risk of spreading the virus to others. How do HIV medicine work? HIV medicine reduces the amount of HIV in your body, which help by first giving your immune system a chance to recover. Even though there is still some HIV in your body, your immune system should be strong enough to fight off infection and curtain HIV-related cancer. Second, reducing the risk that you will spread HIV to others. What are the types of HIV medicines? There are several different types of HIV medicines. Some work by blocking or changing enzymes that HIV needs to make copies of itself. This prevents HIV from copying itself, which reduces the amount of HIV in the body. When do we need to start taking HIV medicine? It's important to start taking HIV medicine as soon as possible after diagnosis, especially if you are pregnant, have AIDS, have current HIV-related illness and infection, have and early HIV infection, which is the first 6 months after infection with HIV. That's all for me. Thank you.